Good morning, everybody. Nikki here. Today's Taste Life Nutrition Radio and Podcast streaming live on KUHSdenver.com, where today we're going to talk about something that is not talked about enough. At least in my mind, it's not talked about enough, because we have our oral microbiome that, we talk a lot about, the gut microbiome and the importance of the gut microbiome, but we have biomes all over the place. And so understanding, what it looks like to support our oral microbiome and how that can impact our global system, our own body in entirety, I think it's a really important thing for us to discuss. So, but as always, we start the show with gratitude. I do believe gratitude can change the world. We have our mental and emotional health, our physical health, and then our relational health, and really gratitude can impact all all of those things. And so I think that this week I'm super grateful for time spent with family and friends over the long Memorial Day weekend. Thank you again to our soldiers who work so hard to protect us and have given us all the freedoms that we have. But we were able to go up into the mountains and do some camping and some cold plunging in a river that was just beyond cold. I mean, it's just, thawed snow. So it was really cold. But we all did it. The kids did it. The adults did it. Everybody did it. We had such a great time. And so what's fun, too, is being gone in the mountains for 4 days, coming back. And the garden is blooming and growing, and we had some rain. And so it's just, this is such a beautiful time of year. It really is my favorite, where things are coming alive, and it's warm and cozy outside. Of course, today it's kind of cool and rainy, so sleeves it is, but that's okay. Grateful for the rain, and grateful for the sun when it comes out. So, all right, so let's get started. I think that, when we have this topic of conversation that we are all a part of these days, really, to a large degree, the gut microbiome is no longer something that most people have never heard of, right? We understand that we are full of bacteria. We understand that they, at least a lot of us now understand that it plays a huge role in our physical health, again, our mental and emotional health. The gut microbiome is 70% of our immune system. It produces 90% of our serotonin, our happy neurotransmitter. We think of neurotransmitters as being produced from brain tissue, right? But that's not the case. It really is produced from our gut microbiome. If our microbiome's healthy, the chances that our neurotransmitters are going to be healthy is pretty high. So, but I think that beyond that, we also have our skin microbiome. We have our oral microbiome. We have, as women, we have our vaginal microbiome. So we have this microbiota that is all around us, that if in balance, which is the key, that it's a huge part of what keeps us healthy, right? These microbes communicate with our organ systems, communicate with our brain. And it's fascinating that really, if you think about it, we're just little bug carriers. We're little bug vessels carrying around our little bugs that do all of these amazing things for us. But they certainly can become imbalanced. What's super cool too is, in my world, if I'm looking at the gut microbiome, we have the ability to test the microbiome. We can look at your commensal bugs, which are your friendly bugs. We can look at the opportunistic bugs, which is when you have commensals that become out of balance. There's too many of them, and so they then become opportunistic or opportunistically pathogenic, right? And then we have our pure pathogenic bugs, right? So bugs, bacteria, parasites, worms, all these things that can really, really wreak havoc on our bodies, our immune system, so forth. So with that being said, though, it's the same thing with our oral health. We have this oral terrain that plays a huge part in our health. It also helps in balancing our gut microbiome. So we have in our bodies these amazing, and I don't know, you can call them probably millions of feedback systems, right? And so our oral microbiome plays a large role in the health of our gut microbiome and vice versa. Now, to take it to a deeper level and just a little bit off topic, but to make it relatable to especially, those of us women who have struggled with infections, in the past, and I'm sorry if this is not okay with you, but it's part of life, or it shouldn't be, but it is. So if we struggle with either periodic or chronic yeast infections, which also can be an oral yeast infection, thrust, this is because we have significant dysbiosis or imbalance of our microbiome. So oral microbiome, gut microbiome, which is a feedback loop to the rest of the body. And so we have potentially then a vaginal biome that is also out of balance. So Candida, which is this type of yeast, is not a pathogenic bacteria, but it's a yeast, but it's not pathogenic, although it is opportunistic. So if we don't have a balanced microbiome, oral microbiome, gut microbiome that keeps it in check, then it will grow out of balance and it will cause problems. So there are a lot of factors that keep these organisms in balance, and we're not going to get too much into that right now, but I think we do want to, I do want to really dig into the oral microbiome and oral health and things that we can do to help to support that oral health, and things that maybe we shouldn't do to help to mitigate symptoms. So one of the things you'll see behind me here is I put together this little guide. So it's kind of a checklist of how you can check your own oral microbiome. And then we have, there's a company, if you haven't heard of it, it's called Biocidin, and they are amazing at supporting our human terrains, right? So it's our terrain that's so important. It's a terrain that supports the microbiome and the oral microbiome. And so they have products that are for a more systemic biome support, and then they also have products that are good for the oral microbiome. These are things that I've been using for years and continue to do so, and will continue to give these things to my clients and patients because they work so well. And the great thing too is they don't disrupt our natural good commensal bugs, right? So consider antibiotics. So if we take antibiotics, we know that it for the most part, not all of them, but for the most part, they wipe out pretty much everything. So they can be super disruptive. If we take a round of antibiotics, I want you to consider this because this is really, really important. If you take a round of antibiotics, it might take a year to 2 years to actually be able to come back from the destruction of antibiotic therapy. This isn't to say that it's never necessary, but I will tell you that I was on call with a couple of functional medicine practitioners the other day, and the comment was there's so many things that we can do to mitigate the all of these reasons that we tend to use antibiotics, that really the use for them is minimal, right? So think about that. Think about that next time. So if you're a woman, you have a yeast infection, or if you have a bladder infection, men, you get bladder infections, or you have a cold, which is viral, but whatever the case may be, you have some kind of bacterial infection, sinus infection. What if there is a way, and there is, of addressing that infection where you don't have to go take completely destructive antibiotics, right? And so think about that, because it's possible. It's pretty cool stuff. But anyway, we have Biocidin, great stuff. So you can download your free checklist. You can download the protocol, and then of course you can just click on the QR code and it'll take you straight to it. So I'm happy to put something like that together because, for one, I think it's kind of fun, but to give you some good information, and it's your own little checklist. So that's it's the stuff that we all need to do. When I was going through it myself, it's like, there's some work that I have to do here. So Okay, so a couple of things that we want to make sure that we discuss is that, you know, our terrain, which is, again, our terrain is our all of our bugs and all of the things that support the bugs, right? So we think of prebiotics that support our probiotics. It's essentially food. So all of this is our terrain. And so it's this amazing ecosystem, and it's this, you know, it's bacteria and viruses and fungi and all of these things that work together, and they support us, they support our body. And so this is a really cool thing that we swallow nearly a liter of saliva every day. And what this does is it continually seeds our microbiome. And so when we, you know, I was talking about, I think I said this already, but just for sake of clarity, is that when we have infections, it's because we are out of balance. And so we consider this dysbiosis. And so we can look at, I started to hit on this a minute ago, but we can look at our labs, we can look at a GI panel, and we can look at the bugs that are commensal friendly bacteria, and we can look at the opportunistic, and we can look at the pathogenic, and we can see all of these things, including then we can see how our pancreas is functioning, how our gallbladder is functioning, and if we don't have a gallbladder, how is that impacting us? Because so many people these days don't have gallbladders, which is a huge problem. If you don't have a gallbladder, I need you to take your digestive enzymes. You got to take digestive enzymes with high lipase. Sometimes somebody will come to me and they have had their gallbladder removed, they're having all kinds of issues. All we do is give them a good digestive enzyme and the world opens up and changes for them. So keep that in mind. It is so key, and we're not told that. I don't have any idea why, but it's super important. And so we can look at inflammatory markers. We can look at all kinds of things through looking at a GI panel. And it helps us to understand what it is that is out of balance, what it is that we need to do to support bringing that biome back into balance. So what's super cool is we also have the ability to test our oral microbiome. Amazing stuff. So we can look at if we have bugs that are commensal, that maybe are out of balance, that become opportunistic and pathogenic, or if we have puron pathogenic bugs, which is what can lead to, you know, the gingivitis and the cavities and all of those things, right? And so, let's see. So if we have an oral microbiome and a gut microbiome, of course, that's out of balance, then it can certainly lead to a compromised immune system and altered digestion, and which is really cool and a little bit scary, but it's also, it can lead to neurological disruptions, right? It can lead to heart or cardiovascular system issues. So it's amazing when we have this. Really what we're taught was to brush our teeth and floss our teeth every day, but we don't really go any deeper than that. And so we want to, so having that knowledge about your own microbiome is really important. Okay, so there are several types of bacteria. We talked about this a little bit, but there are these spirochetes that can be linked to periodontal disease and cognitive decline. And then, of course, we just talked about Candida, which it thrives in biofilms and suppresses immunity. So biofilms are so fascinating because these, you know, whether it's yeast or bacteria, they have the ability to cover themselves in these shells, in these biofilms that can't be broken open. So we can throw antibiotics at them, we can throw all of these things at them, and it may not touch them because these biofilms can't be broken open. Now there are certain things that can disrupt biofilms. There are herbs and not digestive, but like proteolytic enzymes, specific proteolytic enzymes that can go in and disrupt the biofilms. And so biocidin is one of those things that can do that. And so that's why it's so important, you know, when we're looking at antimicrobials, that we're looking at antimicrobials that have the ability to disrupt biofilms, so it can actually get to those pathogens. And so, this is so fascinating to me. Well, let me make sure I hit on this, that biofilms can be under bridges, crowns, and root canals. So I want to hit on root canals real quick because I think this is so misunderstood, and we're told if you need a root canal that you don't have any choice, that you have to get a root canal, which is not the case. But these biofilms, the fact that they can live in these areas, here's what happens. So we have our teeth, right? Our teeth are porous, and our bones are porous. And so we have bacteria that live, again, everywhere. But if we have a root canal, we no longer feel pain. That's all it's doing, is it's keeping you from feeling the pain. But then what it's doing is it also allows for these potentially gram-negative anaerobic bacteria to live beneath the surface. And then what happens, we have all of these tubules and capillaries that go from the mouth into the lymphatic system, into the venous and the arterial systems, right? So it dumps. And so what we're doing is we're allowing for these anaerobic, potentially damaging bacteria to run through the system. So I was at a conference, it's been a couple of years ago now, but there was a biologic dentist who was speaking, and she said 100% of root canals are infected. Now, think about how many root canals the world has. Think about how many root canals you have. This is a big deal. And so the only way to truly know if your root canal is infected is if you go and you have what's called a cone beam scan. And so this cone beam scan can really help you to understand the health of your mouth and the health of the root canals. The problem is, once, having this information, you got to do, well, you want to make the choice to do something about it, right? Because what if these root canals are sending in so much bacteria that is potentially causing cancer, right? So bacteria can be oncogenic, right? Viruses can be oncogenic. So from my understanding, there's not like amazing data on this, but there is some data on it. So it's, in my mind, it's always better to be safe than sorry. So having a root canal, just don't have any more. There are other options beyond having root canals. You got to figure out what those are. And most, you got to go to, typically, you have to go to a biological dentist to understand what the other options are. But you also have you can, I don't know if you call it reverse a root canal. I mean, you can't put the nerve back, but you can open it up and clean it out and let all that gram-negative bacteria out. So I don't know the process behind that. I'm not a dentist. This is not my area of expertise, but it is super important to have the knowledge about options that you have if you do have a root canal, if you know somebody who has it, and to spread this information, right? This is the stuff that we need to hear, that we need to know, and so many people don't. When I do my intake, every time I do an intake, I bet you 75% of the time somebody has at least one root canal. So we got to have the discussion. Not everybody wants to do anything about it, and maybe not everybody believes it. But this is the stuff, when I go to the conferences and these dentists are like, this is what I see every day in practice. I mean, this is a big deal. So, again, going back to doing something like biocidin that can help to reverse some of that microbial infection I think is really key to keeping our oral health intact. Also, though, just doing it on a regular basis anyway, the fact that it doesn't disrupt our commensals, but it does disrupt the pathogenic is, well, I mean, it's a win-win. It's truly a win-win. So we think about going and doing things like, the mouthwashes that we do. So the things like Listerine, I mean, for the love of Pete, this is the worst stuff. And because it's killing all the good stuff. If you're killing all the good stuff, you're allowing all the bad stuff to come in and proliferate. So getting away from these conventional mouthwashes, getting away from the trashy toothpaste that are doing nothing but putting more chemicals in our body, creating more disruption to our oral microbiome, certainly creating disruption to our gut microbiome. All of these things are key to the optimization of our health, right? And so we talk about longevity, that's fine. We don't know how long we're going to live, but I damn sure want to know that as long as I'm here, I'm living well and I'm not full of toxins and I'm not, sitting in a wheelchair and all those things. And so over time, all of these things are going to create this burden, which is how we age. Now, we're all going to age. I get that, but I want to live well and keep moving and keep doing all the things that I can do for as long as I'm here. So all of these things matter. And nobody's perfect, right? But they do all matter. So here's a really gross thing. You may or may not have heard something like this, but it is true. So we all brush our teeth, at least most of us brush our teeth in the bathroom. What are all the other things that we do in a bathroom? All of these, every time you flush a toilet, all of that stuff in the toilet, it aerosolizes, right? You've got all of these particles that are going into the air, and what are they doing? They're going into your toothbrush or in everywhere else. But then your toothbrush goes into your mouth and has the potential to then bring in microbes that are supposed to be coming out. So we don't want to reintroduce these things. We don't want to introduce them, period. Now, we're supposed to have enzymes in our mouth and other microbes that help to protect us from that. But if we have dysbiosis in our oral microbiome, then we may not have the ability to protect us from these microbes. On that note, man, I could go so many directions with this stuff, but I can't help it. On that note, if we do happen to take in these bugs and we swallow them, and then we don't have enough digestive acid, hydrochloric acid, to fight these bugs, then they certainly do go systemic. Then, of course, if we have root canals, they can go systemic. If we have whatever it is, they can go systemic, right? So it's so important to have ample hydrochloric acid which is just acid, right? So many of us are taking these acid blockers and PPIs and these things that block the acid because we think that we have too much acid because we have these digestive dysfunctions. It's not the case, right? And so what we end up doing is we lower acid. We don't have the protection needed to keep any of the microbes, the parasites, the worms that might be coming in, to keep us safe from them, so then they have the ability to proliferate. And on top of that, then we don't break down our protein. We don't absorb our minerals and our nutrients because we're not breaking down our food properly. So then we're malnourished, and then if we're malnourished, we become osteopenic. Then moving on to osteoporosis, and then cardiovascular issues, right? So you can sit here and there are a lot of factors to all these conditions, but we can sit and kind of look at the chain of actions that happen due to one or two choices that we make, right? And so all of these things can happen. So super important, if you are on acid blockers, PPIs, it's really difficult to come off of. It can be done, but you got to work with somebody who knows what they're doing, and know that these are really dangerous drugs. Even if they're now over the counter, they're super dangerous drugs. So that's a whole other topic in and of itself. But it's really, I think it's a key to our health, is understanding the importance of hydrochloric acid in our gut. Okay, so we talk a lot about. Let's see, where are we on time? Okay. So I think I'm going to do this first. So we have a new sponsor who I'm super excited about. And her name is Susan Drake. I've actually known her for quite some time, but she is repping for a company called NuBioAge. And NuBioAge is a peptide company. It's for healthcare practitioners to be used for their patients, right? And so NuBioAge has a lot of amazing peptides. I'm a huge fan of peptides. The more I learn, the more benefit that I see in them. And as I'm starting to use them in practice, it's fascinating what they can do. But we have what's called Guttides or Guttides. I don't know, I just call them Guttides. But they're basically peptides that are specific to gut health. And so there are a couple of them. You've got lorazepam, BP157, which BP157 is super cool. It's kind of this basic, all-encompassing, amazing peptide. It's a, what's it called? BPC, body protective compound. That's what it is. And so it can be used for mitochondrial health, for pain, for gut health, all kinds of stuff. It's pretty cool. And then of course you've got KPV, and then you've got NuBioAge. Butyrate is super important. It's a short chain fatty acid, really important for gut health. It protects the microbiome, protects the bugs, right? The bugs produce it, so protects the cell wall. I'm sorry, the gut wall. And so a lot of people who are struggling with things like Crohn's disease, ulcerative colitis, other types of IBDs, which is, irritable bowel diseases, this can be really supportive. And so, just IBS is just sort of this umbrella for GI dysfunction, right? It's not really anything. It's not a diagnosis. It's just you have belly pain, okay, so you have IBS. It's really kind of sad because there's always a reason, right? We got to remember there's always a reason for symptoms. And so understanding what the IBS means and where it's coming from is key to eliminating the IBS, essentially, which can be done. It can be done. I do it all the time. So anyway, Susan is amazing. She's got some great products that I'm super proud to have her as a partner, as a sponsor for the show. Super cool stuff. So if any of you out there are practitioners who are looking to get deeper into peptides, they have really great education. I've learned so much through their education. They've got a pharmacist that you can talk to. Really cool stuff. So that's her QR code that would go straight to her. This is the gut health protocol. Again, they've got a massive a selection of peptides and other things, but this is their gut health protocol. So I wanted to have it in here because obviously our oral microbiome and our gut microbiome are so closely linked that I think it's important to have resources like these Guttides. So yeah, super grateful for Susan and all she's doing. Okay, so her information is also going to be posted on all the places, the podcast and so forth. So keep that in mind if you want to check that out. Okay, so when we talk about leaky gut, this is pretty fascinating in my mind too, because we tend to separate the gut from everything else, right? And it's so connected, but when we talk about something like leaky gut, it's not just that the gut is leaky. The brain is leaky. The gums are leaky, right? So leaky gut just means that these cells are pulled apart. And so if we get a little sciencey about it, there's a protein called zonulin. It's only discovered just, 10, 15 years ago or something like that. But zonulin, it is normal and natural to the body, and then during certain times it elevates. It tends to elevate, my understanding, like in periods of starvation. In pregnant women, zonulin goes up, and there are reasons that the cells need to come apart. And so, but they're not supposed to stay apart. And what can happen in the case of chronic leaky gut is that zonulin elevates, and they pull apart and they pull apart and they stay apart, right? And so it's basically the contents of the gut are leaking into the vasculature too early, right? So it's supposed to get in there, but it's too big, and so the body starts to freak out. It's like, it's not supposed to be there. I don't know what this is, even if it's just a piece of food, or it could be bacteria, viruses, or any of these other things. But then the body starts to throw out all of its ammo. It's like it's sending out red flags and this amazing immune response, as it's supposed to do, but then it just creates inflammation, right? So inflammation is a normal, natural response as well, but chronic leaky gut leads to chronic inflammation, leading to potentially autoimmune diseases or other diseases that we struggle with. Now, it also is going to be the same with our cardiovascular system. These cells will come apart in the cardiovascular system, and so what's going to happen It's going to send calcium, it's going to send fibrin, it's going to send all of these things to the area of the cardiovascular system because it's protective, it's trying to protect you, right? And so then what potentially can happen is an occlusion, and so we have a heart attack that can happen. But all it is the body's protective mechanisms. The body is so innately, beautifully God made. It's so fascinating what it does. And I think that if I were to, if I have this, if I have a legacy, I don't know, but it's to switch our mindset that the body is against us and it's always, always for us. That's how we're created and that's how we're made. But we have to give it the support that it needs so it doesn't go and lay down calcium in the vasculature, right? So then we go to leaky gums, same thing. So the cells come apart. It has the, it then leads to bacteria and viruses and fungi that can get into that system and then of course into the cardiovascular system. So the wheel goes round and round, right? So making sure that our protective mucous membranes are intact is really, really key to good health, right? Okay, so beyond that, this is interesting. We hear of gingivitis. Gingivitis is a bacteria, and it's called P. gingivalis. There's also one called treponema, and then of course other pathogens. But these are found in patients with Alzheimer's and Parkinson's. So we imagine, just think about how close your oral microbiome is to your brain, right? So not only will it go down, it's going to go up. So there are a lot of factors that go into these neurological issues, but as we start to chip away, these are some of the easy things to make sure that we're addressing to mitigate the potential. And so if you're somebody like me who has a super high potential of Alzheimer's disease due to my genetic makeup, I've seen it in my genetics, I want to, I kind of, you have your list of things that you can do that you do on a daily basis that just become habits, that create habits that help to make sure, hopefully make sure, right, that these things like Alzheimer's don't present. And so that's kind of where I am, and it's cool stuff. And on that note, I reposted this today. We have we are reversing Alzheimer's. Now it's early onset. I think once you get to a certain point, you can't. But if Alzheimer's symptoms and dementia symptoms come from early years and years and years prior to actual diagnosis. So when you know your potential, when you do your testing, and you do these certain things, these are the things that can help you to mitigate disease like this. So we have so much power. It's fascinating the amount of power that we have. So we also have chronic oral infections that can lead to systemic immune activation, leading to things like mast cell activation syndrome. If you haven't heard of this is a nasty, nasty little syndrome, right? And that's what it is. It's a syndrome. It's not a disease. It's a symptom. So we have these mast cells that are part of our immune system, that are important to the immune system, but they go haywire. And they're going to go haywire for a lot of reasons. Infection, toxins in the environment, mycotoxins, all of these different things. So when we're testing, these are all things that we're looking for when we're looking at people who have MCAS or people who have autoimmunity or chronic fatigue. Or, you name the symptom, right? Depending on our makeup, we have the potential. We all have our potential for certain things, but we have the ability to mitigate this potential just by the choices that we make, right? And the knowledge that we have, which is why we do this show. It's for the knowledge, right? Okay, we already talked about root canals, mercury. Come on. Whoever thought it was a good idea to stick mercury in your mouth? And they're still doing it. It just blows my mind. So if you have mercury in your mouth, it's a tough call, because I want to say you just got to go get it out. But if you do get it out, you've got to have it done by someone who knows what they're doing. because it can create a lot more symptoms. There's some people who are just super symptomatic where you start to disrupt that mercury and it can create more symptoms. And so you go back to somebody, you know, I always use myself as an example, but the potential that I have toward Alzheimer's, part of that is due to the variants that I have don't allow me to detoxify mercury properly. So if you think about this, you're putting your mercury in all of these kids. We don't really know their genetics, so you just do it anyway, and then you start to push their potential, and it's this negative potential, right? And so I did have mine removed, not by somebody who knew what they were doing. It was many years ago when I was first learning about this. Thankfully, I didn't have any symptoms at the time, but it's one of those things that it can be a tough call to not push symptoms. But I think if you have the ability to get rid of them, you got to get rid of them. It's just nasty stuff. So then we have all these other toxic things that dentists do. I don't know why. Metal crowns, implants that can leach neurotoxins or cause immune dysregulation in sensitive individuals, right? We've got jaw cavitations, which are necrotic bone pockets post-extraction. Okay, so these are often silent disruptors of lymph, immunity, and neural communication. So on that note, you know, we have been told our entire lives that we have to fill cavities. In my mind, it's just barbaric. Right? I think it's antiquated and barbaric. If we know that our bones can heal, why can't our teeth heal? It just makes sense. And it's not easy necessarily because it means we've got to change our lifestyle, right? You know, we got to bring in the good and take out the bad. But it can be done. I mean, it's data. There are books written on reversing cavities. So, knowing that and certainly there are some people who have, I don't quote unquote, harder teeth than others. Sorry, let's end that. Then they have, and so more people are more prone to more cavities. You know, that's okay, but again, it's still a lifestyle, right? We mitigate, you know, having to have cavities filled by lifestyle, or taking the time to understand why you have cavities in the first place and then what you can do to reverse them. It's cool stuff. Okay, so we talked a little bit about the testing that we can do. I have not done a lot of oral microbiome testing, but I want to. And so there is one that's called oral DNA, my periopath. And so it can identify high-risk pathogens and inflammation-related genes. Then, of course, there's the cone beam scan. We talked about this. Really, really important. We can look at organic acids testing. Organic acids testing, I love it. It's really a difficult panel to decipher, to read, and to understand. But you can really dig a lot of great stuff out of it, as well as the GI testing, right? Looking at your GI to see what it is that needs to be done to balance your GI, which can play a role in, you know, your oral health as well, of course. And so there are markers. I don't know if this really matters, but you know, we can look at markers like arabinose and beta-glucuronidase to help to determine you know, oral microbiome health. And then of course there's things like lymphatic congestion. What is lymphatic congestion? You know, we have our whole lymphatic system that plays such a huge role in our immune system, and the only way for it to move is for us to move. And so it's you know, I kind of compare it to the cardiovascular system, but it doesn't have a heartbeat. So if you are walking, right, your calves, the contracting of your calves helps to move your lymphatic system, but it can still get clogged up. So there are other cool things that you can do, right? You can get a rebounder, the little trampolines. You know, those are really great for lymphatic drainage. Cellcore, they do a lot of lymphatic drainage. Anytime I'm working with someone, especially those who are super chronic, first thing I'm going to do is put them on a Cellcore protocol that is for draining the lymphatic system, but also for you know, liver support, all of the the kidney, the lungs that are play a big role in detoxification. So we want to make sure all of that's moving, and that we're pooping every day. It's huge, and so important in lymphatic drainage and just overall health, is to make sure you're going to the bathroom every single day. Okay, moving on. So I think if we were to hit a little bit on things like mental health and mood in our oral microbiome, infections can elevate cytokines. And what's interesting is cytokines are important. You have inflammatory and anti-inflammatory cytokines. They're an important part of the immune system. But what I find kind of interesting is that most people outside of healthcare probably had never heard of cytokines until COVID. and then we started hearing about the cytokine storm that can happen, and it still is the case, and it's fascinating stuff. But these elevated inflammatory cytokines can affect serotonin and dopamine levels. It can affect the vagus nerve, right? So the vagus nerve is what connects our gut and our brain, but the vagus nerve, it innervates our heart, our GI, and so it impacts heart function, it impacts motility of the GI, it impacts the lungs. And so if our vagal tone is insufficient, then what is that going to do? It's going to impact our heart, it's going to impact our GI, it's going to impact the lungs, and it will impact our mental and emotional health. It'll impact our microbiome. The bugs in our gut communicate with our brain via the vagus nerve. And so, then you have the downstream effects of, the neurotransmitters that are not functioning properly because of all of these things. If your vagus nerve is not healthy, then you're more likely to sit in sympathetic, which is your fight or flight, as opposed to sitting in your sympathetic or parasympathetic, which is your rest and digest. Right? So we want to have good vagal tone so we can move easily between sympathetic and parasympathetic, but we want to stay mostly in parasympathetic because that's when we're calm. That's when all the blood is at the core, gives us the ability to break down and utilize our nutrients because the core blood is at work. Whereas if we're in sympathetic, fight or flight, all the blood goes to the extremities, right? Because you got to move fast, you got to go fast, and sort of shunts it away from the core. So we have less of an ability to break down and utilize nutrients and all the other things that our core is supposed to do. But then, it creates this issue with, back up. If we are in chronic sympathetic, then we're in a constant chronic fight or flight state, which we may not even know we're there. I see this all the time where people don't even know that they're sitting in this chronic fight or flight, right? It's stress, but what is stress? Stress can be physical. Stress can be from illness. It's internal. It can be from autoimmune diseases or kidney diseases, whatever. This is internal stress because it's inflammatory. It's creating more inflammation. Again, that feedback loop. Inflammation creates stress. Stress creates inflammation, right? And then we can have the external stressors. We can have work and relationships and finances and spiritual. You name it. All of this stuff can then come in and create more stress. So it can really this is where we start to see these downward spirals in people who are really struggling because things just continue to move out of control. So other things that are super interesting, because we have an epidemic of mouth breathing, of snoring. I think, right? Beyond just sleep apnea, just breathing with your mouth open can disrupt the oral microbiome, which is going to disrupt everything else. So I don't know if it's a new fad, but I think it's however long it's been around, I don't know, but it's becoming more known. Sorry, keep getting messages. More well known and practiced, especially in the functional medicine world, as we're having our patients and clients doing this, but it's mouth taping. So literally taping your mouth closed, for some it could be a little claustrophobic, but it's not like you can't take it off. It's not like you're using duct tape or something. You just get a little masking tape, tape your mouth closed, and you start to breathe through your mouth. It creates the habit for your body, even while you're sleeping. Not your mouth, your nose. You start breathing through your nose. So if you tape your mouth closed, it allows for your saliva not to dry out, and it's normal breathing. It's the way we were supposed to breathe. Mouth breathing is really, really disruptive. And snoring, obviously, is also very disruptive to everyone involved. So that's a really great habit or something to start to think about doing. I have friends who, they do it all the time. I don't snore, I don't sleep with my mouth open, but I'm tempted to just try just to see what happens. I know I have a friend who, she's like, I don't snore, but I am sleeping better now that I'm doing the mouth taping. So pretty cool stuff. Just get a little bit of masking tape, or, like they have this muscle tape too. You can do that. And do it when you go to bed. Cool stuff. Okay, so, and I guess to sort of top that off, if you're breathing through your mouth, it's a disruptive sleep architecture. That then can move to anxiety, depression, ADD, ADHD symptoms, right? We're even seeing this in kids. So what can happen is kids are nutrient deficient as they're growing, so they don't fully develop, which means for some, or a lot of them, their esophagus and all this area is not fully developed. Not to its full potential, and that's kind of and so it is, it increases their ADD and their anxiety. You can also see it in their mouth. So if their jaw is pushed back, or they just look kind of underdeveloped, if they have black circles under their eyes, these might be things to start to consider what's going on and what's creating this issue. And so for kiddos, a lot of times what happens is they will just put braces on. Braces are moving teeth around, but it's not allowing the structure to develop to its full potential. And so there are specialized dentists, companies, who are starting to help the body to develop fully, right? There are devices and things that you can use that helps the bones to move and everything to develop the way that it's supposed to develop, which can also help to develop the structure of the esophagus. So really cool stuff. So think about that, right? If you've got kids with crowded teeth, it's probably not the fact that they need braces. Braces haven't been around for the entirety of our lives, right? We have all of this data through Weston A. Price of people who had perfectly straight, normal teeth that were not too crowded, but if we're not developing fully, our teeth are going to be crowded. We shouldn't have to pull our wisdom teeth. It shouldn't be a thing, right? Okay. So let's see, move into. So I think we can talk a little bit about what time we got. So yeah, we can talk a little bit about some protocols. So if we talk about, I didn't put it up here, but part of this download are these protocols that I'm going to talk about. I think that that having a good oral protocol is obviously, is what we've been talking about, is super important. But this will give you a good protocol guide on what to look for. It'll give you the resources on where to find it, the whole thing. So the company Biocidin is not the name of the company. I just lost it. Doesn't matter. But Biocidin is the main sort of the product that everything comes off of. So Biocidin is the antimicrobial, and they have a dental Cidin toothpaste and rinse. And so this targets pathogens, of course, without, as we're talking about, disrupting the beneficial flora. So you can do the rinse, you can do the dental Cidin. They also have a probiotic. My husband and I have been doing this for several months now, but there's a specific type of probiotic, salvaricus, anyway, that is beneficial for the oral microbiome. So you take it literally, you take it, you chew it, you hold on to it for as long as you can, you swish it around, and you swallow it. There is even this, I don't know where this came from, and I'm going to say this is not coming from me, it's something that I read, but this type of probiotic, this type of microbe, has also years ago was shown beneficial in radiation exposure. Fascinating stuff, right? So my husband and I have been doing that for quite some time now. So then we also have the biocidin LSF, which is a liposomal form, and the TS, which is, I believe that's the throat spray. So the liposomal form is the form, you can take it, you can swish it around your mouth if you don't want to do the toothpaste, but it also goes systemic. So it's really great to go systemic. Liposomal just means that it is absorbed through the mucosa in the mouth. Now, just because it dissolves in the mouth doesn't mean it's automatically absorbed through the mucosa, because the molecules have to be a specific size in order for it to effectively be absorbed through the mucosa. So this particular product, because of the collaboration through this other company, Quicksilver, that's what they do. They do these liposomal formulas where they're always testing and making sure that the molecules have the ability to move through the mucosa. And so there's this collaboration of the biocidin LSF, which is cool stuff. So I use that one pretty regularly on myself as well as my patients and clients. Tongue scraping, right? Tongue scraping is pretty, kind of that simple thing to do. So making sure that helps to remove biofilms, bacteria from the root of the tongue. Oil pulling, if you've not heard of it, is pretty cool stuff. Essentially, you take either coconut oil or sesame seed oil. I use coconut oil, to me, because it's already got antimicrobial properties in it. So to me, it just makes sense to use coconut oil. But some will show that there's good data for sesame seed oil as well. But you use that and you swish it around your mouth for 5, 10, 15, 20 minutes, whatever you can do. I tend to do it when I know nobody's going to talk to me, if I'm in the shower, whatever it is. I'm swishing around, and I've come to where now I'm adding things to it. So I've made toothpaste this way, and I would oil pull with just my toothpaste, which is the base of the coconut oil is the base of the toothpaste. I've added in binders. I've added in different things like the biocidin. Cellcore has a product that I really love. It's called Para 3. That's a liquid. Lots of oregano, that kind of thing. So I've used that in it. I've put in a certain form of calcium for building my teeth. What else? I've done peroxide. I mean, all kinds of stuff that you can do. It's really kind of fun to experiment. But all of these things that can, good essential oils that are really beneficial for your teeth and, of course, your oral microbiome. Red light therapy is super cool. Remineralizing toothpaste. So, there's certain nutrients, and then your minerals, your phosphorus, your specific types of calcium. You've got to be careful with calcium, because if you brush, you can with calcium, some of them can be just too abrasive, and so that's not good either. So I tend to not brush with calcium, but I'll oil pull with it. And then I think this is kind of in the wrong place, but I think it's important enough to talk about, is that mouth breathing actually disrupts nitric oxide production. So again, if you're disrupting nitric oxide production, this is going to be disruptive to your cardiovascular function, right? So we want to make sure that we're not breathing through our mouths. And let's see. Dental detox. So I kind of already hit on some of these things, but you can do binders. There are certain binders that I think work better than others. My favorite binders are always going to be through Cellcore. They have different binders for different things. So whether it's mycotoxins or biotoxins or heavy metals, environmental toxins, you've got binders that are. This is all chemistry that I don't get. But they are chemically created to bind to certain things, and it's all by the electrons and neurons and protons and things, again, that I don't really get. But it's that's how they bind them, is through these chemistry methods, right? So Cellcore, they have a chemist on board, and he always does his during the conferences, he'll do his talks, and they're fascinating, but it's like, it's just so far over my head. I don't get it. As long as it works, that's really all I care about. So, great antioxidants. Antioxidants are always important, right? We have so much oxidative stress from the environment and all of these other things. So, having a good liposomal glutathione, you can do glutathione IV. You do want to be careful if you have glutathione SNPs. It can, taking straight glutathione can be problematic for some people. Sometimes you don't know that unless you know your epigenetic makeup, or you go and you do a bunch of glutathione and you don't feel good. So something to keep in mind. But you can do NAC, which is N-acetylcysteine. It's a precursor to glutathione. Really great for detox. CoQ10, super important mitochondrial support, important for cardiovascular and heart health, and immune function. So other great mitochondrial support, which is always important for detox, always important for the microbiome, because toxins are going to disrupt your oral microbiome and your gut microbiome. So making sure that you're detoxifying properly. There's PQQ. Don't ask me what it stands for. I don't remember. But anyway, a lot of times you'll find CoQ10 in combination with PQQ. And so that's a really great mitochondrial supportive combination. B vitamins. B vitamins are super important to detoxification. Many of us are really, really deficient in B vitamins. I see it all the time when I'm doing micronutrient testing. So that can be, that's where we want to get our nutrients through food. A lot of times we're not. If we're not eating a perfect diet, right? Nobody's perfect. Our foods are not as nutrient dense as they used to be if we're eating conventionally raised food where the soils are scraped and just, not regenerated, essentially, right? So those are, unfortunately, all things that we have to keep in mind. And then, of course, minerals to regenerate tissue and to boost recovery. So we have to be absorbing our nutrients. Let's see. I think that we are probably at a point to where we can stop. I could probably go on about this stuff forever. Everything is connected. I think that's really one of the key takeaways here. But I think last but not least, just knowing that your oral microbiome is not just, it's not just about going to the dentist. It's not just about brushing your teeth and flossing. There's a lot to it, but it's a lot of simple stuff. I mean, that's what's great about it. It's just pretty simple stuff that we can do to take care of our oral microbiome, take care of all of these, little friendly bugs that are there trying to keep us healthy. And remember, that's all our body really is trying to do every day, is keep us healthy and keep us alive. And so it's our job to have the knowledge to come in to support it however best we can do that. So download the oral terrain. So there's the QR code right there. It'll be posted. I think it's going to be posted it will all be posted after this. I don't think it's posted yet, but it will be. So you can go to the QR code. It'll lead you right to where you can download the checklist and download the biocidin protocol. And then, of course, if you have any other thoughts or questions, I'm always here. You can reach out to me. Reach out to me via the website, or you can just call me, whatever works. But the website, tastelifenutrition.com, and then Taste Life Nutrition in all of the social media. And then there is a free assessment on the website where you can fill that out, and I'll reach out to you and we'll chat about it. So last but not least, thank you to Susan Drake for her sponsorship, for her being a big and integral part of health and of healing and of being a resource to healthcare practitioners with the amazing products that she has. She has a lot of cool things, and so as we move through this, we'll be talking about different things that she has available to practitioners. And if you are a patient or a client, these are things that you can start talking to your practitioner about. If they don't already know about it, this is a great way for them to start to learn. Having the educational resources is key. That's how I continue to learn, develop my own knowledge and understanding, and try to stay on, at least to the best of my ability, on the cutting edge of some of this stuff. There's really cool things coming out in the world of you know, functional holistic healthcare, even, you know, oncology, right? If we're looking at all of these things in a holistic manner, from a functional foundational manner, we should be able to start to uncover the root causes of these things. Then we know how to start to mitigate them. So we are, I think, at, you know, sort of this cusp of really starting to have a big impact on some of these massively detrimental chronic diseases. And we're pushing, and, you know, we're screaming and shouting, you know, at the top of our lungs to start keeping this thing moving forward. So anyway, let me know if there's anything that I can do. You'll find us here again next week, every Thursday, 10 a.m. Mountain Time, streaming live on KUHSdenver.com. We'll see you again here in a week. Bye.